It's going to be presented as a late breaker, and we'll have to wait the reaction. My prediction is this will change clinical practice overnight. These patients are sick. Some of them are actually skinny because of their disease. And after 5-6 months to find another spot where you can inject is quite cumbersome for these patients. So now that we have shown in this study of more than 1,000 patients that the treatments are comparable or identical, I believe many physicians and many patients would prefer the oral therapy. I also predict that the guidelines will be updated and will include this oral edoxoban once a day as an alternative.